In the first two sections, we talked about the disorders of musculoskeletal system and gastrointestinal tract during the antenatal time. Now we will talk about in this third section about the abnormalities of pelvic organ that can occur in antenatal period. In this section, we will talk about the fibroids and retroversion of uterus, congenital uterine anomalies, and ovarian cyst and cervical cancer. So first, let's talk about fibroids. Fibroids are also known as leiomyomata. Fibroids are compact masses of smooth muscle that lie in the cavity of the uterus, submucous. There are different areas of the uterus where the fibroids can develop. Fibroids are common during pregnancy because of hormonal changes. Increased in the level of estrogen and progesterone leads to formation of fibroids. And even during the pregnancy, there is some bleeding from the fibroids also. So as the hormone levels keep on increasing, fibroids grow and they can bleed also. If the fibroids become so big that they can affect the growth of the baby, then they should be treated during pregnancy. So fibroids that are present in the cavity of the uterus, they are known as submucous or intracavitary fibroid. You can see this fibroid is in the cavity of the uterus, intracavitary. Then this is a pedunculated fibroid. Pedunculated is a small stalk to which the fibroid is attached. So this is pedunculated, intracavitary, submucous in the cavity also. This is submucous. Then there is intramural, subserous. All these are the different types of fibroids that can be present. Again, this is the different intramural fibroids, submucosal fibroids, subserous fibroids, named after the layers or the areas in which the fibroid is present. This is red degeneration. You can see there is redness, and this red degeneration occurs because when the fibroids become so big that the blood supply is not enough, leading to ischemia that can lead to red degeneration. So fibromas or fibroids are masses of smooth muscle that lie in the uterine cavity. Next is the retroversion of uterus. As the name shows, retro is backward. So in this, the uterus it is retroverted, so it flips over or it flip out and start growing towards the rectum and slowly, instead of towards the abdomen, and slowly it can fill the whole pelvic cavity. So flip out of pelvis and begin to fill abdominal cavity and fills eventually the entire pelvic cavity. So this is retroflexed uterus. So instead of growing up, it start going downwards, flip out, and it start growing towards the rectum. Next, some of the congenital abnormalities of the uterus. These congenital anomalies are in the shape and structure of the uterus, and it can lead to different complications of shape of the uterus because of the fusion of the Mullerian ducts. So there is the congenital abnormalities mainly affect the shape of the uterus, and it is fusion of Mullerian duct that gives the shape to the uterus. And if there is anomaly of the shape of the uterus, it can lead to miscarriage, preterm labor, premature rupture of membranes, abnormalities of lie and presentation, and high C-section rate. So all these complications can occur if there is abnormality of the uterus. Some common abnormalities that can be present, we have didelphys. Didelphys, there is di means two, so it can be double uterus with double vagina. So two conditions are present in didelphys uterus. It may be two uterus and two vagina, and it may be two uterus or double uterus and single vagina. That's didelphys. Then there is another condition known as bicornuate uterus. There are two cornua of the uterus, two cornua. Instead of single, this cornua, there are two cornuas. So it can be shaped like this or it can be shaped like this. So bicornuate uterus. The other condition is septate. Septate uterus, you can see this is the septum that divides the uterus into two halves. This is the septum. And then the fourth condition is unicornuate uterus. There is only one cornua. So we have didelphys, bicornuate, septate, and unicornuate. All these are congenital uterine abnormalities, lead to preterm labor, premature rupture of membrane, miscarriages, abnormality of lie and presentation, and high C-section rate. Septate uterus is usually because of abnormalities of fusion leading to subseptate uterus. Another abnormality is ovarian cyst. This is the normal ovary. These are these ovaries with the cysts. Cysts are fluid-filled sacs. So polycystic ovaries. You can see multiple cysts are present in the ovary. Serous cysts and benign teratomas are present. Large ovarian cysts. Usually if the ovarian cysts are large, they can undergo torsion, and as a result of torsion, there is severe abdominal pain because of the lack of blood supply. It can also lead to hemorrhage or rupture and acute abdominal pain. So ovarian cysts are the cysts that are filled with fluid, and they can be serous or benign teratomas. If large, they can undergo torsion, they can go rupture or hemorrhage. Cervical cancer. Cervical cancer is, if cervical cancer is present, then it's very hard to visualize the cervix at colposcopy. Colposcopy is examination of the cervix with the help of colposcope. So this is the presence, if this is the growth is present or cancer is present, usually it's hard to visualize the cervix. So this is small growth less than 4 centimeter. This is large more than 4 centimeter. Vaginal bleeding is present in late stages of carcinoma. Radical hysterectomy or chemoradiotherapy is performed. Radical hysterectomy is the cervix is removed and uterus is removed. So and then followed by chemotherapy or radiotherapy. So cervical cancer if it's present, leads to bleeding and treated by hysterectomy and chemoradiotherapy, and then it is hard to visualize the cervix through the cancer. This was all about the section 3, in which we talked about some disorders of pelvic organs in the antenatal period. Thank you for watching sqadia.com.